Hey y'all, this is Rohit Verghese, back with week 5 of the QBank remediation. I'm back with another 3 questions that I wanted to talk about for this week. Now the first question goes as follows. The nurse supervises the newly licensed nurse during the insertion of a vascular access device, or VAD, on an older adult client. The client has a history of type 2 diabetes, diastolic heart failure, and a right mastectomy 15 years ago. The client has a BUN of 24 milligrams per deciliter, a blood pressure of 92 over 60 millimeters of mercury, and a heart rate of 96 beats per minute. Which observation concerns the nurse? Now the answer choice that I picked, which was incorrect, was the nurse inflates a blood pressure cuff to 46 millimeters of mercury prior to insertion of the VAD. Now this is incorrect because the blood pressure cuff can be used in place of a tourniquet to dilate the veins and reduce the risk of hematoma and infiltration, particularly in the older adult client. Now the correct answer was answer choice number 4, which was the nurse cleans the right hand with an antiseptic solution prior to insertion of the VAD. And so this is concerning because the client had a right mastectomy and the use of the right arm should be avoided. Also, even though the hand is often recommended, there's an increased risk of hematoma and infiltration with an older adult client. And that is why the answer is number 4. Moving on to question number 2. The question reads, the nurse prepares to discharge a client diagnosed with acquired immune deficiency syndrome, or AIDS. The client is going to live with the parents so that they can assist with care. Which action does the nurse take first? Now the answer choice that I picked, which is wrong, was answer choice number 2, which is assess if the client and parents understand the dosing schedule and adverse effects of the medication. Now this is incorrect because client independence should be encouraged. Before moving forward to educate the parents, the nurse should first assess whether parental help with medication administration is even needed. Now the correct answer is answer choice number 3, which is ask the client about what kind of help is needed from the parents. This answer choice is correct because the nurse should first determine the client's needs and then assess whether the parents are able to meet the client's needs. After assessment is complete, the nurse can begin implementation. And so that's why answer choice 3 is correct. Now, moving on to the next question that I got wrong, question number 3. And so the question reads as follows. The nurse observes the unlicensed assistive personnel, or UAP, providing care for a client diagnosed with disseminated herpes zoster, which is shingles. Which UAP action requires the nurse to intervene? So now this is a select all that apply question. Excuse me. And so answer choice number 1 was ambulating the client to the nurse's station. Answer choice number 2 is donning gloves, a gown, and N95 mask prior to entering the client's room. Answer choice number 3 was refusing to enter the client's room due to a personal positive titer. Answer choice number 4 was performing hand hygiene upon entering the client's room. And answer choice number 5 was using the unit equipment to monitor the client's vital signs. And so there were 4 answer choices that were correct out of these options, but I only selected 2 of them. Now, the 2 that I selected which were correct were 1 and 5. 1 was ambulating the client to the nurse's station. Now, this is correct because the client diagnosed with shingles is placed in contact and airborne isolation. Therefore, ambulating the client to the nurse's station increases the risk for infection to others who may not be immune. Excuse me. And the second answer choice that I clicked, which was correct, was answer choice number 5, using the unit equipment to monitor the client's vital signs. And so this is correct because isolation rooms must have dedicated equipment to prevent hospital-acquired infections and cross-contamination between clients. Now, the two answer choices that I did not pick but were also correct were answer choices number 3 and 4. Answer choice number 3 was refusing to enter the client's room due to a personal positive titer. Now, this is correct because the UAP is immune to varicella zoster, which is chickenpox, based on the positive titer, and the nurse will discuss this with the UAP. And answer choice number 4 was performing hand hygiene upon entering the client's room. And so this is correct because hand hygiene should be done prior to entering a contact precaution room. So you do it outside the room first, and then you step in. So that's why that is also correct. And with that, those were the 3 questions that I want to talk about this week. I hope you guys have a great day.